Okay, doctor, start.
Okay, Dr. Asba, your patient is Mr. Imtiaz. Dr. Imran, case number 4.
Okay.
Mr. Imtiaz, 50 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Okay, Mr. Imtiaz, 50 years old.
Yeah, doctor. Yeah.
Okay.
Okay, doctor, start.
Yeah. Hello, Mr. Imtiaz. My name is Dr. Asba. How can I help you today?
Doctor, actually, my big toe like keeps on flaring up, and I also have pain in my flank.
Okay, can you please tell me more about this, Mr. Imtiaz?
Yes, doctor, this pain in my toe started suddenly and it's really severe. I just cannot tolerate it. And since last year, I got 3 times this pain. And every
Mhm.
time it lasts about 5 to 7 days. I don't know what's wrong with it, but I cannot bear it anymore.
Mhm. Okay, I'm sorry to hear that. May I know a few more questions about this condition?
Sure, doctor.
Okay, for how long you have this problem?
Since 1 year now, this pain
One
is
year
coming back. Hmm.
coming. Okay, and it started suddenly, as you told me.
Yes, doctor. Pain comes
Okay, can you
suddenly.
please tell me the exact side, which toe, which side of the toe?
Big toe,
Big toe
big
of
toe,
right or left?
right side.
Right side of the test. Okay, and is this pain go anywhere?
No, doctor, it stays there.
At that time you have this pain?
Not right now, but doctor, just it comes and goes. Now, third
Mhm.
time it came a week ago, and then it settled. I was taking this Brufen for it.
Mhm. Okay, okay. Is there any redness with it?
Yes, doctor.
Okay. Can I see this your toe?
Right now it's fine.
Okay. Okay. Is there any fever with it?
No, doctor.
Okay. Any numbness?
No, doctor.
Okay. And this is the third time, as you told me.
Yes, doctor.
Okay. And is there any associated weight loss,
No, doctor.
fatigue,
No,
tiredness?
doctor.
Okay.
When
And
it
along with
comes,
that,
then
you
I'm.
told me that you have pain in flank also,
Yes, doctor.
right side or left side?
Doctor, sometimes I got in the right and sometimes left.
Okay. And along with that, there is any urinary problem? Any pain during urine, passing
Yes, I
urine,
get burning. Yes.
burning? No, at that time you have this?
No, doctor.
No, no. Okay. Okay. Apart from this, do you have any long-term illness
Yes,
like
doctor, I
high
have
blood
high blood
pressure?
pressures.
You have high
Yes.
blood pressure for how long?
Yes. For 13 years now.
13. And what you are taking for this?
I'm taking this thiazide.
Thiazide. Okay. How much, do you remember the dose?
No, doctor, just take it once daily. And
Okay.
sometimes I have to take it more often because my blood pressure isn't controlled, so I take it more often.
More often. You taking it regularly. And your
Hmm.
blood pressure is controlled with it? Are you checking your blood pressure regularly?
No, doctor, I'm not checking.
Okay. And along with that, do you feel any chest pain?
No, doctor.
Any headache?
No, doctor.
Okay. Apart from this, do you have high blood sugar?
Yes, doctor, not high blood sugar, but I went for this and it's pre-diabetes.
Pre-diabetes. Okay. And do you have high blood cholesterol levels? Have you ever checked before?
No, doctor, it's
Okay.
not high.
Okay. In your family, anyone have this type of problem like you?
Doctor, no.
No. Okay. Apart from these medicine like thiazide and brufen, as you told me, any other particular drugs you are taking?
Uh, just this Brufen occasionally for my pain.
Okay. Any drug allergy you have?
No, doctor.
Okay. What do you do for your living?
And doctor, I work as an accountant.
Okay. And what's the environment at the workplace? Is everything fine?
Yes, doctor, everything fine, but it's mostly sitting job.
Mm-hmm. Okay. And okay, with whom you live at home?
With my wife and two kids.
And everything is good at home?
Yes, doctor.
Okay. What about your mood these days?
Our mood is fine, but
Fine.
it's
Okay.
pushed by because these attacks again and again.
Okay. Please tell me about your diet. What type of diet you are taking these days?
I'm fond of mostly spicy food and junk food and mostly
Mm-hmm.
meat.
Mm-hmm. Mm-hmm. Okay. Okay. And have you doing any exercise these days? Are you doing
No, doctor.
anything?
My weight is increasing also.
Okay. Well, do you know about height, weight according to your height?
31.
31. Okay. Do you smoke?
Yes, doctor. 10 cigarettes a day since 10 years.
10 years. Okay. And drink alcohol?
Yes, doctor. Very much.
Mhm. Okay. And do you have any idea what's going on with you?
Doctor, I just don't know. Maybe this is some kind of um crystal problem I read on the internet. It's uric acid
Mhm.
problem.
Okay, we will definitely talk about it. And any particular concern?
I'm just worried about my toe and now my kidneys also.
Hmm. Okay. And what do you expect from me?
Just okay, I need medication that I need. I just don't need any painkillers more than that.
Hmm. Okay. And do you, and this condition, how impact this condition your life?
Doctor is just annoying me that there is 1 week I have to take off because of this pain. I cannot even walk or put pressure on my feet.
Mm-hmm. Okay, okay. I can understand you are in a very difficult time. Okay, Mr. Imtiaz, let me summarize it that you told me that you have a pain in your big toe from last 1 year on and off, and along with the flank pain and some urine problem, and you are thinking that there is some crystal problem, and you are here to give you some medicine for this. Anything else you want to add?
No, doctor.
Okay, I want to examine you. Do you allow me?
Sure, doctor.
Okay, with the proper hand sanitization, shop chevron, and proper privacy, I will start the general physical examination with the hand, pulse, BP, blood pressure, and check the eyes for a pallor and jaundice. And then I will examine the foot. Okay, is there any redness, swelling, and with the finger between the toes, any discharge? And I will touch the palpate it, and then and move the finger, big toe. And apart of this, I also examine the back. Okay, and I will please sit down, and I will examine it from the back to do the renal punch for the costophrenic at the costophrenic angle, and I will also check the edema of the foot. Anything and
Okay.
then
Right now,
thank you so
patient
much.
is just BMI 31, comfortable today, just mild residual tenderness and big toe, otherwise fine.
Okay. And okay, Mr. Imtiaz, after taking your history and examination, I am suspecting that you have a condition which we call the gout. Okay, do you have any idea about this?
No, doctor.
Okay, it is a condition which crystal for accumulate in our body, our joints when our kidney are unable to uh, release it from the body. Okay, so for this
Okay.
confirmation, are you getting my point? So
Yes,
at that
doctor.
time, I want to do some investigation. Do you allow me?
Sure, doctor.
Okay, I want to check your uric acid level, CBC, ESR, okay, and your kidney function test,
Mm-hmm.
electrolytes, okay, and so electrolytes, kidney function test, and that's it. I will do this.
Pending.
Pending. Okay, Mr. Imtiaz, I want to discuss some management plan with you. Are you with me?
Sure,
So
doctor.
I want to say is there, according to your condition, this condition I am suspecting that this condition is because of your medicine which you are taking of your for your blood pressure, thiazide. Are you with me? Are you getting my point?
Yes, doctor.
This
Yes,
because
doctor.
this medicine cause the increase crystal like uric acid in our body. Okay. And
Okay.
or apart from that, as you told me that you have mostly junk food, you are eating and eating meat. Okay. Meat is also having the high protein which produce this type of crystal. Okay.
Mm-hmm.
So at that time, I want to give you the some advices about your lifestyle and give you the some medicine. Okay. So at that I will. Okay. And I am please take a healthy diet, low meat diet, less green vegetables.
Time
And
up.
I said,
Time up.
okay,
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 doctor. So next case, doctor.
Okay. Uh, just 1 minute. Okay. Case number 2, doctor.
Okay. Okay, Dr. Asba.
जी yes sir.
Acha. Uh, Dr. Imran, sorry, case number 1, in fact.
Okay, case number one.
Patient
Okay.
name. Patient name Mr. David, 45 years old male, came to discuss his problem with you. Please proceed with history examination and management plan.
Okay, Mr. David, 45 years old.
Mm-hmm.
Okay, can I start?
Yes, doctor, start.
Okay. Okay, hello Mr. David, my name is Dr. Asba. How can I help you today?
Doctor, I just want to check my reports.
Mm-hmm. Okay, can you tell me more about this?
Yes, doctor, I went for these reports. I want to know what's wrong with me. Can I show you?
Yes, please show me the report.
Okay, so HB is 9.8,
Okay,
MCV 72, low MCH, ferritin low, platelets mildly raised.
ferritin low and or platelets
Mild raised.
mild raise. Okay. Mr. David, may I know some for a few questions about your condition, about your report before telling you? Do you allow me?
Sure, sure,
Oh,
doctor.
may I know why you did this report?
Doctor, it's just a screening test they were giving me, and I went for it. And now they told me something is less in my blood. So I just come back.
Okay, okay. Do you have any idea what's in this report?
No, doctor.
Okay, and any particular concern in today consultation?
Just I'm worried about any disease. Is it normal? I just want to know if it's normal. Normal.
Okay, and what do you expect from me?
I need a scan, doctor.
Can okay. Okay, Mr. David, may I ask you question?
Sure, doctor.
Okay, for how long do you have any difficulty in breathing from last when you have did this last 1 month, 2 month, any problem in your breathing?
Yes, doctor, very much. I feel tired since 3 to 4 months, and even last few weeks I was feeling a bit short of breath when I was climbing the stairs.
Mm-hmm. Okay, and do you feel dizzy along with this?
Yeah.
Okay, and in any part of your body, do you have in any history of bleeding blood, like blood in vomit, and anytime you
No,
have in this?
doctor.
No. Okay, any what about your bowel habits? These are okay?
Yes, doctor, they are regular, but just slightly looser than before.
Well, for how long you have this problem?
I didn't notice it just come and goes. I feel like it's normal thing.
Okay, along with that, do you have any unintentional change in your weight, loss of weight?
A little bit, yes, doctor. I felt like 1 to 2 kgs in last few weeks.
Mm-hmm. Okay, and any tummy pain on and off with this?
No, doctor.
Mm-hmm. Okay. Do you have any long-term illness like high blood pressure?
Yes, I have this joint pains, osteoarthritis.
Okay. For how long you have this problem?
For 7 to 8 years.
Okay. And are you taking specific medicine for this?
Yes, doctor, I was taking this Brufen. They told me my calcium is low, so that's why it's my problem. So I'm taking calcium tablets off and on.
Mm-hmm. Okay. And in your family, anyone have this type of problem? Any
No,
gut
doctor.
problem?
This which yes, doctor. Actually, my father he had some gut problem. Then he got cancer and he died because of it.
Mm-hmm. Very sorry to hear this. And at what age he was died? He was diagnosed and died this problem?
Doctor, at 67.
67. Okay. Okay. Can you please tell me, do you have any apart from Brufen, any other drug you are taking these days?
No, doctor.
Hmm. Okay. And what do you do for a living?
I'm like an accountant.
Accountant. And how everything is good at work?
Yes, doctor.
With whom you live at home?
With my wife.
Okay. And do you smoke?
Yes, doctor.
Do you drink alcohol?
Yes, doctor.
Okay. Can you please tell me how many cigarettes you smoke and how long you are taking this?
10 to 15 cigarettes since 10 years now.
Okay. Okay. What about your diet?
I'm taking normal diet only.
Okay. Okay. Are you doing any physical activity?
Sometimes, but just a walk.
Okay. And do you know your weight according to your height?
23.
23. Okay. Okay. Okay, Mr. David, as you told me, and this condition, please tell me this condition is impacting your life these days? Is you feeling this problem?
Yes, doctor. And since I have this report now, I'm concerned about it.
Concerned about it. Okay. Yes, I will. You have a concern. I will definitely talk about it. Okay. And Mr. David, I want to summarize that you have some reports with some less blood and you have some difficulty in breathing, and you came here to tell you that what's inside the report and do some scan. Okay. Anything else you
Yes.
want to add?
No, doctor.
I want to examine you. Do you allow me?
Sure, doctor.
Okay, with the proper hand sanitization chiffon and proper privacy, I will check your vitals and the hands for the pallor and alkalinuria, and I will check the eyes for pallor and jaundice, both for cyanosis, and I will examine the tummy. Okay, please, if you allow me, can you expose the tummy? I will examine this. Okay, I will examine,
Okay.
inspect any scar mark, any swelling, and then I palpate superficial palpate and then deep palpation for any swelling and any mass inside. Okay, and then auscultate the bowel sound, and I will also do the direct digital rectal examination also in the proper shift. Anything, and after that, thank you and proper hand sanitization.
Conjunctival pallor present, looks pale.
Okay,
Otherwise, no non-tender, no organomegaly.
okay.
Did you do DRE?
Yes, I said I will do DRE in the
Okay.
proper second attempt. Okay.
Okay, nothing on that also.
Okay, Mr. David, after taking your history and after what taking look at your reports and examine you and asking few question, I am telling you that you have a something have a problem in your tummy. Okay, so I want to
Mm.
do some investigation, which is called a fit test. Okay, this is a. Do you know this?
No, doctor.
It is a basically screening test. As you told that you have your father also have the gut problem, gut cancer. So this problem uh, can transfer the kids also. So and sometimes and you have the less blood as because sometimes this blood unseen blood come in our stool, which we not see in the naked eye. Okay, so I will do this. This is a screening test. So I will do first this test, and after this test, I will am referring you to the gut specialist doctor. Okay, so after this test report, he will do some camera test for you. which is called the colonoscopy. Okay, to check what is going on inside your gut. I- Are you getting
Okay.
my point? Are you
Mm-hmm.
getting my point? Are you with me?
Yes. Yes, doctor.
Okay. So, apart from this, I am advise you some lifestyle change. Okay, please take a healthy diet, do some physical activity. Okay, and take
Okay.
a, and do some physical activity. Take a healthy diet. Try to quit smoking. Okay, think
Mm-hmm.
over about it. If you will think over it, we will discuss it in a separate session. Okay, I will give you the leaflet. Please think about it to quit about smoking. Okay,
Okay.
okay. And
Doctor, is this
also,
test necessary?
yes, at this time it is necessary because after all the examination and after all the data gathering and your report, this report shows that at the time, and also you have a history of your family now. Are you getting my point? So at this time, it is important at this stage to screen you for this
Mm.
problem. Okay, is there any
Doc
something special inside? Is there some serious going on or not?
mm-hmm.
So okay, are you getting me?
Okay.
Okay, so
Yes,
after this
doctor,
we
can
will.
I take iron tablets?
No. At that time, I'm not giving prescribing you at any time iron tablet. Okay, because after
Okay.
okay, but just to take a healthy diet, green leafy vegetables, and diet with milk intake, and diet with the meat like this. Okay, which you have a good rich iron.
Mm-hmm.
Okay, and after this screening test and a proper investigation confirmation, then the doctor will proceed you that doctor will uh, proceed with this problem. Okay,
Okay, doctor.
anything else you want to ask?
No, doctor.
Okay, thank you.
Okay, Dr. Asba, 6 seconds remaining. Okay, great. So, doctor, what's next?
Yes. Mrs. Emily, case number third. Mrs.
Okay.
Emily, 35 years old female, came to discuss problem of her child. Please proceed with history exam and management plan. Examination not required.
Okay, this is Emily. Okay.
Case number third, doctor.
Yes, doctor.
Okay, start.
Hello, Miss Emily. My name is Dr. Asba. Oh, how can I help you today?
Doctor, I'm really worried about that there's something not right with my son.
Mm-hmm. Miss Emily, may I know what is the name of your son?
His name is Jack,
Zach, and his age?
4 years.
4 years. And may I know where he is at that time?
He's at home, and I didn't bring him. He's just staying with his other friends.
Mm-hmm. Okay. And where is your husband? He's with you?
No, doctor.
Mm-hmm.
He's on job.
He's on job. Okay. Please, I bring next time with your husband. Okay. With son
Mm.
also. Okay.
Doctor
And
Isba, the son is in nursery, not at home.
okay,
Okay.
nursery. Okay, okay. Okay, okay, Miss Emily, can you please tell me know more about what you are to discuss with me about your child?
Yes, doctor. Actually, my child, when I'm talking with him, he's not even responding properly, like not looking at me, and
Mm-hmm.
he doesn't respond to name consistently. And
Mm-hmm.
he speaks in like few words, like short phrases, and
Mm-hmm.
also repeat some phrases from the cartoons. And I thought it's normal, but now his nursery is telling me there's something wrong with him, and I should
Mm-hmm.
get him checked.
Mm-hmm. Okay, Miss Emily, you have a valid concern. I think that every mother at that time can have this type of concern when you have any issue in the school and anything else, anywhere else. Okay, can you please? I want to ask you more questions. Do you allow me?
Yes, doctor.
Okay, can you please tell me for how long you have feel this problem? At what age just you start to notice this?
I didn't notice it a lot, but when he was 2.5 years old, I felt that he is not speaking like other kids.
Okay. Mm-hmm.
First words were around 2.5 years.
Mm-hmm. Mm-hmm. Okay. Okay. Okay, Miss Emily, can you please tell me about his birth? His birth is normal or normal
Yes,
delivery
doctor.
or cesarean, cesarean section?
Normal.
And everything was fine during the pregnancy? You have any
Yes,
specific?
doctor.
Okay. And at the time of birth, he was okay? His weight is normal?
Yes, doctor.
He cry? Anything, any particular problem at the time of birth?
No, doctor.
Okay. Okay. And what about his immunization? His immunization is up to mark up till now?
Yes, doctor.
Okay. And what about his diet? What type of diet he's taking these days?
He always eats what we cook for him. Doesn't like, it's not a picky eater.
Okay. And what about his development? What at what age he sit and what age he start to normal age and with delay you notice anything else? Uh, Just
Everything was normal, just his speech was delayed. Like I
um,
felt 2.5 years, as I told you.
mhm. Okay. Apart from speech, do you notice he can easily maintain his eye contact with you? Do you notice anything this?
No, doctor, he cannot.
He cannot maintain anything. Okay, and he has some specific found of some specific toy. Do you notice which
Yes,
is
doctor, he
hold
has.
on? Okay.
Yes, he's particular in his toys and he lines up toys rather than like playing. And he also sensitive to loud noises.
Mm-hmm. Okay, and he pay attention to your instructions.
No, doctor.
And he did any and what about his school performance? What the school nursery teacher says he can socialize with other students.
No, doctor. He is very
Mhm.
socially awkward.
Okay, okay, I can understand it's a valid concern, and it's very difficult for you to hear about your child the time. Okay, and can he sit properly at one place for 1.5 hour and more time? Mm,
Yes, doctor, he can sit, but he's very slow.
very slow. Okay, okay, and can you please tell me apart from this, he have any other problem?
No, doctor.
Okay, and what is your how many kids you have?
He is the only kid.
Only kid. Okay, and what's your last menstrual period?
2 weeks ago.
Okay, and are you taking any contraception?
Yes, doctor.
Okay. What you do for your living?
I'm housewife.
Housewife. Okay. What's your husband doing?
Doctor, he works long hours and he stays mostly out of house.
Okay. And how's the relation of your husband and you with him? He easily mingle with you. He happy with you when you spend time with
Yes,
you.
yes,
And what?
doctor, but he's very slow.
Okay. What about his screen time? How much time he spend with the screen?
Not a lot, doctor. We try to
Mhm.
stay with him,
Mhm.
but he watches cartoons on screen.
On screen. And do you notice he mostly watch same type of cartoon again and again?
Yes,
Okay, and okay, during these days, are you giving any medicine, specific medicine to him?
no, doctor.
Okay, anything, anyone in home smoke?
No, doctor.
Okay, and he's taking in these days he's taking homemade food or mostly junk food like this.
Homemade.
Homemade. Okay, and do you have idea what's going on with him?
Doctor, I just strongly feel like he's slow and maybe he's not developing like other kids.
Mm-hmm. Okay, and what is your particular concern?
I'm worried about his future independence, his schooling, and
Mm-hmm.
just that if I did something wrong,
Mm-hmm. And what do you expect from me?
I want assessment and diagnosis.
Mm-hmm. Definitely, I will help you. Okay, and did this condition impact your life?
Yes, doctor, a lot I'm
Yes.
worrying about it.
Okay, Mr. M.A., I want to summarize too that you came here to discuss with his son Zach, which is having a problem with development speech problem, delay speech, and some eye contact problem, and you came here to do some investigation and tell that what's going on with him. Anything else you want to add?
No, doctor.
Okay, Mr. Emily, after data gathering, I want to tell you that I am suspecting that he has a problem which we called in our medical term is the autism spectrum disorder. Do you have any idea with this?
No, doctor.
Okay, it is a condition. This is basically a neurodevelopmental problem, and it is mostly in. This is the not exact cause of this. Maybe this is some is saying that this is some research says these are genetics, and some says it's a someone says there is some environmental issue problems can cause this condition. Okay, so
Hmm.
are you with me?
Yes,
So
doctor.
at that time, I want to send you to the I want to send you the psychologist to for the child psychologist, child brain mind doctor
Hmm.
to proper evaluation of him. Okay, so please, is it possible to you bring with him tomorrow? So I will check him thoroughly and examine him properly, and after that I will send him to the after examine and proper examination I will send him to the child psychologist for further evaluation and confirmation of the diagnosis. Can you bring him tomorrow?
Yes, doctor. Yes, doctor.
Okay, okay. So, and apart along with this, I am reassure you that this condition, many kids in these days have this condition. So, with the passage of time, with proper sport and therapies like speech therapy and physiotherapy and occupational therapies and some educational training programs, okay, and have in these days, and these children can easily cope up these problem these days, and they can survive better in his life. Okay, so and
Okay.
along with that, are you with me? Along
Yes,
with that,
doctor.
there are some parents training program also there. So I will also recommend you after the confirmation of the diagnosis to attend this training program. They will help you to find the how to cope up with and how to help this type of child to cope up with this problem. Okay, and with the proper
Okay, doctor.
intervention, proper therapies and proper your sport, he will be easily spend and
Time
cope
up.
up with this problem.
Time
Anything
up,
else you
Dr.
want to
Asba.
add?
No, doctor.
Thank you.
Uh, Dr. Asba, good attempt. I must say that you're doing hard. A few things you have to add on. At this point, first of all, we are not going to here to address each and everything. The reason because if like say we will be pointing out and we will be notifying on few things specifically which is mandatory to know from the examiner angle rather than mostly based on a knowledge based. Let
Okay.
me tell you why. Because now almost 3 weeks left. Not three
Mm-hmm.
weeks left, less than 3 weeks left. Okay. So
Mm-hmm.
here, what we have to do it, which is a mandatory thing that there no one is doing, no one will do the perfect. Even the position holders also having the mistakes over there. But there
Mm-hmm.
is no such thing, doctor. But the
Mm-hmm.
thing, you did a good job.
Mm-hmm.
Few important points, just please note down from in your side. So it will
Okay.
be easy for you with you home you're doing the practice. So it will be easy to capture
Okay.
at the moment. Okay. First of all,
Okay.
doctor, from my side, um, let the SP complete the sentences.
Okay. Okay, sir.
Um, then, doctor, apart from that, doctor, when you're asking, should not use double barrel questions. Okay. One
Okay.
question, one time.
Okay.
Okay. Second thing, doctor, you are taking little bit more longer scenario, longer sentences while addressing the patient. So you have to shut
Okay.
down, shout it down. One is we call it, may I examine you? Okay. You
Okay.
are saying that I am going to examine you. Should I examine you? Something like this. No, doctor. You
Okay,
have to say that may I examine you? Means like say one, two, three, four. Four
okay,
words are there, three longer, one shorter. So may I
okay.
examine you?
Makes sense.
Mrs.
Okay.
Khan. Okay, Mrs. Khan is agreed. But if you are going to say in two sentences, it will be time consuming. Here, time matters,
Mm-hmm.
doctor. Okay,
Okay,
apart
good.
from that, doctor, when you are dealing with a patient without patient and only proxy case is there,
Mm-hmm.
so you have to make sure that you are taking more humble thing. Okay, humble
Okay.
thing means like say because patient will be distressed.
Mm-hmm.
Yes, without original SP, proxy case or is a more sensitive case to discuss and deal, there you need a
Mm-hmm.
5 minute. You took almost 8 minutes in data gathering, which is
Mm-hmm.
little bit more longer. Here, no, doctor. Here, patient came with autism. Okay,
Mm-hmm.
or your patient came with some sort of ADHD or whatever, so on. So, my choice, I should not go with a longer data gathering. I should shorten it up and I have to come to the point. So,
Mm-hmm.
mother come with behavioral concern. Okay,
Mm-hmm.
because why I am talking on this kind of cases because these are the from the past paper. Most commonly came in the exam. Okay,
Mm-hmm.
and most commonly tested scenarios and most commonly tested topics are there. So scenario might change, but topic will be the same.
Mm-hmm.
Okay. So
Okay.
please look into this. Second
Okay,
thing,
sir.
doctor, when patient, there was one patient with you, that first case was a gout with recurrent toe
Mm-hmm.
pain. Okay. This was the exam, exactly exam scenario. And
Mm-hmm.
it came in the exam, but patient had a kidney stones.
Mm-hmm.
Okay. So have you asked about any renal stone?
No. I
Okay,
asked
uric acid.
from but not
Yes, top five, multiple joint pain. Always ask about
Mm-hmm.
thyroid and
Mm-hmm.
this problem because this is interlinked. These are the interlinked things are there. We have to talk about because these are the sensitive point here. Either agenda will be thyroid. Okay,
Mm-hmm.
patient will be having hypercalcemia or sorry, hypo or hypercalcemia, whatever, so on. Or
Mm-hmm.
might be patient having hyperuricemia. Yes, patient is alcoholic. Okay. Yes, patient
Mm-hmm.
is taking thyroid diuretic. But apart from that, patient had acute attacks out there.
Mm-hmm.
Okay. And patient having CKD or some sort of some kidney problems, maybe recurrent stones are there. Background history is mandatory. Either
Mm-hmm.
it will be obesity, metabolic syndrome, type 2 diabetes,
Mm-hmm.
CKD,
Mm-hmm.
then hypertension. It can be psoriasis. It can be hematological issues, anything.
Mm-hmm.
Okay. So please take on this. Second thing, in your second case, it was anemia.
Mm-hmm.
Okay, it was a 2 weeks referral to cancerous pathway. The reason
Mm-hmm.
because strong family history and patient
Mm-hmm.
age.
Mm-hmm.
So here you must be more
Humble and
and humble and take pause.
pause.
Pause
Okay.
for a while and look at the patient. In a real exam scenario, you have to look at the patient. Don't
Mm-hmm.
lose the eye contact.
Mm-hmm.
Okay, and you will be seeing that there will be a one tissue paper or there will be glass of water or maybe something.
Okay.
Okay, he or she will be suddenly start crying or will be distressed.
Mm-hmm.
Okay, so
Okay.
if like say patient is a female, you can put hand on the shoulder, but if male, don't put hand on the shoulder because
Mm-hmm.
that opposite gender not allowed.
Mm-hmm.
Okay.
Okay.
Second
Okay.
thing, doctor, you have to say you said that it is a genetically something. No, you should not
Okay.
break the bad news because this is
Okay.
there is no such you partially break the bad news. Okay, here you have
Mm-hmm.
to take the one advantage. Mr. Khan, I have gone through your history and your report. I found that you have the problem we call it anemia, loss of
Okay.
blood. From the history, to rule out further what is the exact cause. We need to send you to the specialist. Doctor, what
Mm-hmm.
specialist you're going to send me, Mr. Khan? I'm going to send you to that gut specialist. Why, doctor? Why
Mm-hmm.
are you sending to gut specialist? This is the second question will be there from the SP.
Mm-hmm.
No, Mr. Khan, first of all, let me tell you, because since in young patient, male, very less likely we are getting this problem, but mostly it is happening because of iron absorption or
Mm-hmm.
some other gut issues where your body is not taking up the iron or your
Mm-hmm.
body is not taking up the nutrients. Okay,
Mm-hmm.
to rule out what is going on over there, so we need to check. Doctor, do you think that I have that same colon cancer like my father? Mr.
Mm-hmm.
Khan, at this moment, I will not say that thing because we are not pretty sure. We need to rule out further to come on to your concern. So that's the reason we are going to send you. So here you took twisted little bit sentence and you because patient will try to put on your mouth something that you have to spark,
Mm-hmm. Mm-hmm. Okay.
okay, to spoil
Okay.
the case. So here
Okay.
you have to catch the patient.
Mm-hmm.
Mr. Khan, exactly, it's not like this what you're saying because only with one this blood investigation report we can't say that what's going on over there. We need a
Mm-hmm.
lot of things to do it, and at the moment at our practice level, we don't have that much facilities. For that reason, I'm sending you to that one. Doctor, so still he will be saying, Doctor, do you think doctor is going on something worse than with me? No, no, Mr.
Mm-hmm.
Khan, it's not like this. Okay. And the history also, there are many things are there we can talk about. But the thing, as your it matters, the life matters. So that's the reason we have to rule out further to exact cause, how to treat and how to go through this situation. Are you getting, Mr. Khan? Yes,
Mm-hmm.
doctor. So here he patient wanted to see how much for you can go. Okay,
Mm-hmm.
they will be keep on telling you a lot of things, but still you have to hold the boat.
Mm-hmm. Mm-hmm. Okay.
Okay, so that's it from my side, doctor. From your side.
Yes, Dr. Asba, like a few things, like one of the things, like active listening. Even though the patient told you like he's not keeping eye contact with me, so we will not ask the same question,
Again. Okay.
which the SP already told us.
Mm-hmm.
And we won't use the word data gathering. We will tell whatever you told me, I'm concluding, like something like that, but
Okay.
not these. Yeah.
Okay.
And otherwise, I felt that you did second case better than the first, and third case better than the second. So,
Yes, at first time I was confused between two. There is a one
yeah,
gout and one the renal colic also. So I'm confused
yes,
how to manage these two now. So
yes,
yeah, so that's why, and it was the first
mm,
time, first slit.
yeah. It's a good thing that second is better than the first, or next is better than the
I have
previous.
a
So it's a good
question.
thing. And yes, Dr. Anosha, we will take question in a while. Secondly, Dr. Asba, in the first case, trigger should be ruled out. Like we need to ask Socrates completely. Socrates wasn't complete.
Mm-hmm.
Anything that aggravates it, anything that relieves it,
Leave it.
the
Okay.
pain.
Okay.
Aggravation was with the alcohol, relieving
Mm-hmm.
was with medication.
Mm-hmm.
And otherwise, and when you said that this is because of your medication, no, here multiple factors are involved, like meat, alcohol, medicine, all together.
Together. Okay. Okay. And
And mostly when the patient, yes, when the patient with this gout or flank pain or most likely kidney stones, we will ask for the fluid intake.
fluid intake. Okay. Okay.
Mm.
Okay, and I want to ask in the first case, so what we will take first, we stop the medicine, change the medicine, na? And there is we start the precautionary, the recurrent gout attack. We start any medicine for prevention, or only the change the medicine will improve, and with the lifestyle, water intake and dietary habits change.
Okay. First, we will see if it's hyperuricemia gout or how much the uric acid is increased because we
Mm-hmm.
can start from the lifestyle management. But he has already gotten 3 times, so it must be really increased. So tell him to decrease on the meat and alcohol, and meanwhile keep on checking his blood pressure, like keep recording of your blood pressure. And if after 2 weeks of decreasing alcohol or completely cutting down, he's getting better or no other attacks, then we can think of switching the thiazide also.
Mm-hmm. Okay,
But
at
we
that time we
start
will
bit
not
by bit.
switch. At that time we will not switch.
You
Just
will tell
continue.
him that after the lab reports,
And okay, okay,
medication.
okay. And if the patient was told that the lab report and patient lab report uric acid is more with a high level, then we will
Yes, yes,
stop the change the medicine, and can we start
yes.
and we will start the precautionary like allopurinol like things or not, like there is a recurrent
Um,
gout, huh?
yes, yes, we can start
We can start
on
we
the
can
basis
start
of
the
the uric acid.
allopurinol, or we have to refer for further. Sir, we can start the precaution.
Actually, gout is after the needle aspiration. The confirmation is after the needle aspiration. We can give him the symptomatic treatment, and I guess
Okay.
after the confirmation, we can start on the preventive medications.
Okay. Okay.
Okay.
Yes, doctor. So who's next? Dr. Saima,
Doctor,
right?
I want to ask one question, Dr. Imran.
Yes, doctor, please.
Yeah, in case of anemia, patient was asking, will you write some iron tablets for me? So my thinking was, I think we should prescribe something. Can you please comment on
Yes,
it?
doctor. Yes, doctor. There are two patterns are there. For example, if patient you're suspecting any cancerous pathway, so there are two school of thoughts are there. One, you can prescribe. Second, patient we having this, strong indication like patient having weight loss or insensible, blood loss. We don't know there is a blood loss, so we should not prescribe anything because it might mask or it might exaggerate the stomach health. Okay, so this was the exact question being asked in orientation program by the doctor. Two examiners, those came in exam or those came in orientation. They said based on the like say young patient, yes, you can go for it, but with a strong family history or you're suspecting patient is elderly, like say more than 60 male, so it is a cancerous pathway, you should not prescribe any iron tablets. Okay, then again this is based on doctor scenario. For example, if patient is a young patient, this kind of things are there and you don't have any strong clue that you can write down and you can send the patient, because since this patient is asymptomatic patient, you should not start the medication. Yes, patient having symptoms are there. Patient is having some sort of low blood, dizziness, drowsiness, or whatever so on. Patient feel lethargic, exhausted. Yes, you can write down, but again you have to see if patient having stool discoloration is there, patient having a constipation, patient having a stomach ulcer or stomach problem is there. Please bear that you should not write down.
Okay, doctor, thank you.
Yeah.
But this patient was taking Brufen as well.
Yes, doctor.
So we have to stop.
Yes, doctor, we have to stop Brufen. How we have to ask before that how much he is taking the Brufen.
Mm-hmm. So
Okay, and
for
for
how much?
what reason patient is
Occasionally, yes.
taking and regularly or not regularly. Because sometimes patient is taking the Brufen, but he is taking maybe weekly one time or two time. Or maybe he's taking daily five time or four time. Maybe he's taking more than 1,200 mg daily, which is more than recommended dose. Okay, so it is based on that again. Okay, doctor. So
Okay.
Dr. Saima.
Yes. Dr. Saima, case number third.
Yes.
Okay.
Oh, sorry, second.
Case number
Um,
second. Okay.
yes, Mrs. Farah, 28 years old, female, came to discuss her problem with you. Please proceed with history, examination, and management plan.
Okay. Mrs. Farah, 28 years old.
Yes.
Yeah. Start.
Okay. Hello, Mrs. Farah. I'm Dr. Saima. How can I help you today?
Doctor, I have this cough for weeks now, and I'm really worried about it.
Mm-hmm. Can you tell me more about it?
It's been going on sixth week, doctor, and mostly I'm getting this cough. Sometimes I have this sputum also, and I occasionally felt that there is streak of blood in sputum.
Mm-hmm. Okay. For better understanding, Mrs. Farah, um, may I ask you a few questions? Is that okay?
Sure, doctor.
So, Mrs. Farah, you told me that you have cough from 6 weeks and it's dry. Is that okay?
Yes, doctor.
Okay.
Sometimes,
And okay, tell me.
sometimes I
Hello.
get a sputum like white or yellow sputum.
Mm-hmm. Okay. So, is it happened all of the sudden?
Yes, doctor. I don't know why it happened like 6 weeks ago.
Mm-hmm. And from the 6 weeks, is the like is the cough is increased? or is the same?
It's the same, just since 6 weeks.
Mm-hmm. And okay, so it's the same like for the night and day as well. Am I right?
Yes, doctor.
Okay, you told me that you have a sputum as well. So can you tell me the color of the sputum?
Sometimes white, sometimes yellow.
Mm-hmm. Okay. And what about the blood streaks?
It's occasionally.
Okay. Okay. And about the amount of sputum?
It's not a lot, little bit.
Sorry?
It's not a lot, just a little bit, doctor.
Okay. So, Mrs. Farah, do you have any fever along with it?
No, doctor.
Mm-hmm. Any weight loss?
I feel that I lost weight like 4 kgs in last 2 months, and doctor, I feel these night sweats also.
Mm-hmm. Okay. Okay. So, any recently, like you have traveled somewhere?
Mm, no, doctor.
Okay. And have you got any flu in the last 1 month?
Mm, no, doctor. But, yes, but sorry, I got a recent travel back from like for 2 months, about 6 months ago.
Mm-hmm. Can you tell me where did you go? When, sorry.
I went 2 months back,
Mm-hmm. To where?
Pakistan.
Ah, okay. So, what about your travel? Was there anyone who was coughing?
Yes, doctor. My cousin recently was diagnosed with this kind of TB. That's why I'm really scared.
Mm-hmm. And how many times, ago he was diagnosed with the TB?
It's the first time.
No, no, no. How many months ago?
When we were there and he was suffering from this similar condition. He was coughing around, and then we
Mm-hmm.
got to know that he is TB later.
Mm-hmm. So, is he taking medication now?
Yes, doctor.
Okay. What about his condition now?
Doctor, I don't know. We didn't have any contact back.
Mm-hmm. Okay. So, okay. So, Mrs. Farah, do you have the same condition in the past?
It's the first time.
Mm-hmm. Okay. And you told me that you have cousin as well. Okay.
Hmm.
So do you smoke?
No, doctor.
Any alcohol consumption?
No, doctor.
Any recreational drug you are using?
No, doctor.
Mm-hmm. And what about your sleep?
My sleep is fine.
Okay. What about your diet?
Everything is good.
Mm-hmm. So what you are doing for the living, Mrs.
I'm
Farah?
housewife.
Housewife. Okay. And do you have kids?
No, doctor, but I am pregnant right now.
Mm-hmm. Can you tell me how many months or weeks you are pregnant now?
18 weeks.
18 weeks. Okay. Okay. So by any means, is your husband is like coughing or not?
No, doctor, he is well.
Mm-hmm. Okay. So, Mrs. Farah, what do you think? What's crossing your mind, Mrs. Farah?
Doctor, I just thought it was a long flu, but then I was thinking about my cousin and I thought maybe I got a similar thing, TB.
Mm-hmm. Okay. So we'll talk about it. And what's bothering you the most?
Doctor, I'm worried about my baby and also if the treatment will affect or harm him, harm the
Mm-hmm.
baby.
Oh, okay. And what's your expectation from me?
I just want to know what is wrong and what I need, any test or any treatment in pregnancy.
So, Mrs. Farah, how this condition is impacting your life?
Doctor, I'm worried in these days.
Mm-hmm. Okay, so Mrs. Farah, you told me that you have cough from 6 weeks and along with the sputum and some blood streaks in it. and you want some medication for it. So is that all? Or you want something? You want to add something?
No, doctor, that's all.
Mm-hmm. So because Farah, is that okay? If I can do some examination?
Sure, doctor.
Okay. First of all, I will hand sanitize my hands, and under the chevron cover, I will do the general physical examination with the hands, and then with the nails, and I will do the this pulse and BP, and I will check any lymph nodes, any lumps and bumps, and then I will ask you, is that okay? I can examine your chest. Then I will see I will inspect the chest. Sorry, I will check your chest for the respiratory rate, and then I will do the auscultation for the four heart areas and as well as the basis of the lungs. Any finding?
Uh, Patient appears acutely distressed, mild crackles in the upper right zone. Otherwise, uterus appropriate for 18 weeks.
Okay. So, Mrs. Farah, uh, I will go for some investigation. Is that okay?
Yes, doctor.
Okay, so I will do some CBC, ESR, and for X-ray, I will do some abdominal shield. Like I will prescribe X-ray as well, but it will be with the shield, so it will not harm your baby. Okay, and I will take 3 sputum test for the gene expert and for the sensitivity of the rifampicin. So result
Okay.
result pending.
Result pending.
Okay. So, Mrs. Farah, what I'm expecting from the history and examination that you might have the condition which we call as TB. Do you have any idea about it?
Yes, doctor. It's very bad condition.
Mhm. Okay, so it is actually the lung infection, which is caused by a bacteria. So we will do these investigations, and meanwhile, I will prescribe medicines and will refer you to the DOT program as well. Is that sound okay?
Okay, doctor. But will those medication be good with my pregnancy?
No, I'm telling you for that. We will prescribe you for medication, and these will not affect your baby. So these include rifampicin, isoniazid, pyrazinamide, and ethambutol, and along with it, I will give you the B6 as well. Is that sound okay?
Sure, doctor.
Okay. Initially, it would be for the 4 months, and your main treatment will go through the DOTS program. And beside that, what's your BMI, Mrs. Farah?
24.
24. Okay. So, Mrs. Farah, is that okay that you can cover your face for 2 weeks? Can you do that?
Sure, doctor.
Okay. And this infection is not spreading by eating, yeah, sharing, or sharing utensils. So, but just you have to cover your face. Can you
Time
do
up.
that?
Okay, doctor. Next case.
Okay.
Give me 1 minute. Okay.
Case number 5.
Okay, right.
Okay. So patient name Mr. Peter, 62 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Mr. Peter,
Yes.
and age?
62.
62. Okay.
Okay, start.
Hello, Mr. Peter. I'm Dr. Saima. How can I help you today?
Doctor, actually my calves really ache when I walk and I have to stop after a short distance.
Okay. And okay, so sorry to hear about this. Can you tell me more?
Okay, it's like when I'm walking about 100 to 150 meters, It's so much pain, like cramping, and when I sit down, it gets better in few minutes. Then I walk again. It's been going on 6 months.
Mm-hmm. For the better understanding, Mr. Peter, is that okay that I can ask you a few questions?
Sure, doctor.
So, Mr. Peter, is the okay? Um, okay, is this happened all of a sudden?
Yes, doctor, it is increasing day by day now.
Mm-hmm. Okay. And what about okay, any fever with it?
No, doctor.
Okay, so you said that it's relieved with the sitting, and what about it's like do you feel any pain now?
No, doctor.
Okay, and do you have any similar condition before, Mr. Peter?
No, doctor. This is the first time I'm getting it.
Mm-hmm. Okay, and any swelling in the calf?
No, doctor.
Mm-hmm. Okay, and any long-standing medical condition like any heart problem?
Yes, doctor, I have high blood pressures and type diabetes and high lipids also.
Mm-hmm. Okay, so what you are taking for these issues?
I'm taking ACE inhibitors, Ramipril, metformin, atorvastatins, only these.
Atorvastatin, Ramipril, and what else?
Metformin.
Metformin. Okay. So is your blood pressure is controlled?
Yes, doctor.
Okay. When you checked last time?
Doctor, it was 170 by 100 I checked last time. It's not controlled.
70 by 100. Okay. And okay. And what about your sugar level?
Didn't go to check it in a while.
Mm-hmm. And how much your metformin you are taking?
500 milligram morning, evening.
Mm-hmm. Okay. Okay. So, okay. And what about any similar condition in the family, Mr. Peter?
No, doctor, no one has the similar condition.
Mm-hmm. Okay. Are you smoking?
Yes, doctor, 20 cigarettes since 40 years now.
Mm-hmm. From how many years?
20 years, 40 years.
40 years. So, Mr. Peter, this is too much. So, have you thought of quitting cigarette?
No, doctor.
Okay, I will give you the leaflet about it, and whenever you make your mind of quitting, so we will be having another session on that. Is that sound okay?
Sure, doctor.
Okay, and what about the alcohol consumption?
I take it occasionally.
Mm-hmm. Okay, and what about the recreational drugs you are using?
No, doctor.
Mm-hmm. And what you are doing for the living, Mr. Peter?
Doctor, I'm not working at the moment. I just stay at home, sitting all the time
Mm-hmm. And with whom you are living?
with my wife and my son.
Your wife and son. Okay. And what about the conditions at home?
Everything is fine.
Okay. And what about your sleep?
It's normal, doctor. I just sleep a lot of hours.
Mm-hmm. And what about your diet?
I'm taking, doctor, actually, I'm taking fatty food also. That's why my weight is increasing.
Mm-hmm. Can you tell me your weight to height ratio?
29.
Mm-hmm. Okay. And can you do like normal activities at home, for example, like going to bathroom and cleaning yourself?
Yes, I
Can you do
am
that?
doing on. Yes.
Okay. Do you have any vision problem?
No, doctor.
Mm-hmm. Do you have any shortness of breath?
No,
Okay. Any leg swelling?
no,
Any dizziness?
no.
Okay. And okay. So, Mr. Peter, what's causing your mind?
Doctor, maybe this is poor circulation.
Mm-hmm. Okay, we will talk about it. And what's bothering you the most?
Doctor, I'm really worried about losing my leg or any heart attack or anything like that.
I hope it's not like that. And what's your expectation for me in today's consultation?
I want test and treatment to improve my walking.
Mm-hmm. And how this condition is impacting your life?
Doctor, yes, I just cannot walk like I used to, and that's why I'm sitting most of the time daily.
Mm-hmm. Okay. So, Mr. Peter, you told me that you have this calf pain while you are walking from 6 months, and you have high blood pressure, high lipids, and sugar as well, for which you are taking medication. So, is that all, or you want to add something else?
No, doctor, that's all.
Okay, I want to do some examination. Is that okay with you, Mr. Peter?
Sure, doctor. Sure, doctor.
Okay, first I will do my I will hand sanitize, and then I will, under the cover of chevron, I will start with the GP general physical examination, like with the hands, and then I will check the nails. I will check the blood pressure and pulse and lymph nodes in the neck or anywhere in the body. Then I will check the lower limb edema, and as well as the dorsalis pedis artery and posterior tibial artery will check, and will ask you to just can you um,
Mhm.
show me your legs to check for the and to check for any swelling and in the both legs, and I will inspect the legs for any deformity or for any scar, something like that. And then I will do the palpation for any temperature or so many other findings. And that's all. Any finding? And sorry, and I will check the chest as well. I will auscultate the four hard areas as well.
Okay.
Is there any finding?
Okay. Reduce hair growth on the shins and dorsalis pedis and posterior tibialis reduce bilaterally. Poor capillary refill. Otherwise normal.
Mhm. Okay. So, what about the sensation?
No, no loss of sensation.
Okay. So, Mr. Peter, I'm confused actually. Okay. So, Mr. Peter, I think you are suffering from a condition which we call as the peripheral arterial disease, along with the peripheral neuropathy. Have you heard about it?
No, doctor.
Okay. So, in this condition, like it's just like a chest, like a chest pain. So a thrombus usually forms in the blood pipe of your blood pipes, with which actually when you are walking, so it decreases the blood flow. So that's why when you are walking, so it gives you the pain. And but on the other hand, you told me that you have this uh, hair loss on the limbs and reduced this blood flow in the blood pipes, okay, of the legs. So which goes towards the peripheral neuropathy as well. So um, is that okay that I can give you some advice before?
Time up.
Okay.
Okay, doctor. Last guess.
Mm. Just give me 1
Case
minute.
number 6.
Okay.
Patient Mrs. Rachel, 35 years old male,
Mrs.
female.
Rachel,
Yes, female. Came to discuss problem. Please proceed with history and management plan.
age, sorry,
35.
35. Okay. Can I start?
Okay, doctor, start.
Okay. Hello, Mrs. Rachel. I'm Dr. Saima. How can I help you today?
Doctor, actually, I went for this scan of my tummy, and now I'm really worried about it. It shows there is cyst in my kidneys.
Mm-hmm. Okay. Can I see the reports?
It shows bilateral multiple kidney cyst,
Bilateral multiple cyst. Okay.
consistent with, yes,
Consistent with what?
diagnosis, adult
Okay.
polycystic.
You told me. Okay. 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 So, okay, I'm sorry to hear about it, Mrs. Rachel. So, can I ask you a few questions? Is that okay?
Sure, doctor.
Mm-hmm. Okay. So, Mrs. Rachel, may I know that why you did these tests? Like, sorry, ultrasound?
Doctor, it's just I was feeling a dull flank pain and discomfort, and actually my father had the similar condition. And I don't know what's going on with this, but I want to know more about it. And they also told me that I should go for a heart check.
Mm-hmm. Okay. So, for the better understanding, I will ask. Okay. Okay. Sorry. Um, Okay, so can you tell me that do you have the similar have you done this ultrasound before?
This is the first time.
This is the first time. Okay. And what about your father?
Doctor, actually, he had a similar condition and he went on dialysis. And he also
Mm-hmm.
had intracranial aneurysm in his 50s. And now I'm really worried because I am having the similar problem.
Mm-hmm. Okay. So, Mrs. Rachel, can you tell me that do you have any like burning micturition with that?
No, doctor.
Okay. Any blood in the urine?
No, doctor.
Okay. What about any like high blood pressure?
Yes, doctor. One few readings were coming of high blood pressures.
Mm-hmm. Can you tell me that when you what is the last reading?
I don't know, just they checked my blood pressure and they told me to have a follow up with the doctor. I guess, doctor, it was 150 by 100.
150 by 100. And have are you taking any medication for that?
No, doctor.
Oh, okay. And what about do you have any high blood sugar?
No, doctor.
Mm-hmm. Okay. Any heart problem?
No, doctor.
Any weight loss?
No, doctor.
Any fever?
No, doctor.
Okay. And do you smoke, Mrs. Rachel?
No, doctor.
Uh, any alcohol consumption?
No, doctor. Oh, moderate alcohol.
Mm-hmm. Okay. And what about the recreational drugs?
No.
Mm-hmm. Okay. And what's your BMI, Mrs. Rachel?
24.
24. Okay. And are you married?
No, doctor.
Okay. So what you are doing for the living?
Uh, I'm an accountant. Sorry, I work in marketing.
Mm-hmm. Okay. And I want to ask a sensitive question. Is that okay with you?
Sure, doctor.
Okay. Are you sexually active?
No, doctor.
Okay. And okay, so okay, so what's your diet?
Doctor, I'm taking normal diet, trying to take healthy foods.
Mm-hmm. Okay. And what about your sleep, Mrs. Rachel?
Everything is fine.
Okay. Um, so beside this, ultrasound, have you done any other tests?
And no, doctor, only this.
Mm-hmm. Okay. Mrs. Rachel, what's crossing your mind?
Doctor, I don't know. I think it's kind of genetic disease that I got from my dad.
Mm-hmm. And what's crossing your mind?
I'm just worried that it's about ending up on dialysis like him and having something wrong with my brain also.
Mm-hmm. I hope it's not. And what's your expectation from me in today's consultation?
Yes, yes, doctor. I just want any clear explanation or screening test for my family members also, and what should I do also?
Mm-hmm. Okay. So, Mrs. Rachel, you told me that you have done this ultrasound, which was this bilateral multiple cyst, and you are worried for the complications. Is that all, or you want to add something else?
That's it, doctor.
Mm-hmm. Okay. So, Mrs. Rachel, first of all, I want to do some examination. Does that sound okay?
Mm-hmm.
Okay, I will check.
And
First of all,
examination
sorry.
is not required.
Okay. Because I want to check your blood pressure at that time. Okay.
140 by 90.
Mhm. Okay. So, Mrs. Rachel, are you using any medication?
No, doctor.
Okay. Any allergy?
No, doctor.
Okay. So, Mrs. Rachel, I will write some investigations to you. Is that sound okay? Beside this
Sure, doctor.
ultrasound, which okay. So I will do some kidney function test and will do some lipid profile for you. Okay. And as you told me that you don't have any urinary symptom, but still we will go for the urine analysis. Is that sound okay?
Okay, doctor.
So investigations result pending.
Yes.
Okay. So, Mrs. Rachel, as you told me that your father also has like this same condition, and along with the some you know other neurological problems as well. So, what we will do, yes, with the multiple bilateral cyst, you are like this is a like genetic condition, which is like autosomal dominant genetic condition, so which run in the families, and the other your other siblings can have this condition. For that, we will screen your other family members as well, and we will send you to the specialist as well. Is that sound okay?
Sure, doctor.
So they will do the other scan as well for you, and meanwhile, your this your BMI is 24. Okay, so what you will do beside that, you will try to take healthy food. Can you do that?
Sure, doctor.
And and for the blood pressure, I will give you the medicine, the Remipril. I think I'm wrong actually. Okay, and um,
Okay,
I'm stuck.
doctor. Okay, doctor. Which
And
specialist I should go?
I will send you to the this nephrologist.
Mm-hmm.
No, not nephrologist, sorry, for the medicine and specialist, medical specialist.
Okay, doctor.
Okay. Thank you.
Dr. Saima, you have still 20 seconds remaining. So,
Sir, I'm totally blank in this case.
no worry, doctor. It's okay. Doctor, first of all, I'll start from this case. From here itself, I'll tell you when I'm questioning everyone that opening statement and closing both are equally important. If you ask about opening statement as open-ended and you didn't mention, you didn't ask any closing statement that do you have any questions and queries to ask? Is there anything else you wanted me to ask? So it means patient is not going to tell you anything, or they are not going to open up another chapter, but they will see how much you are patient centered. Okay. Second, doctor, when there is a report patient will not require any kind of examination. Outside it will be written there is no examination required. Okay, so
Yeah.
when this is outside written, so please take care of that one. Polycystic kidney disease, definitely it will be written over the blood that ultrasound report or whatever the report. So just you have to look into that one, and you have to ask how much you know about that one. You have already mentioned, and what you want to know, and what is your thinking. Okay, so as you have to ask earlier. So here you took almost 6 minutes and 30 seconds in data gathering. I can understand because when we are not getting any clue, so we will be dragging the history. That's a quite a normal human behavior for us. So in the data gathering, doctor, there are few things are there. Most of the time, with the report patient, they will come up with that ideas concern everything. Maybe they read on the Google. They put this step report on the Gemini or maybe Chat GPT, and they gone through. Okay, I'll tell you one of my patient in your scenario. Um, she come to me and she said, Doctor, my full blood count report says that I'm having B12 deficiency along with I'm having some looking for thalassemia. I told, okay,
Mm-hmm.
how you got this one? So she said that I put on Google, sorry, this one, ChatGPT, and ChatGPT mentioned this thing. I told, okay. Then I started taking out the history. There was nothing such thing wrong with that one. So patient was passing through some sort of chronic issue, like say constipation was there, or some simple dietary habits or something was there. Patient was not eating properly. But when they put the report, they will upload the report in ChatGPT somewhere. So that as a AI they will be picking up that negative points and they will be highlighting the things. Okay. So unfortunately, here in exam also they will be having agenda. Doctor, I wanted to know about report because I gone to ChatGPT. It was saying that polycystic disease. Oh, okay. We will discuss on that one, Mrs. Khan. So, is there anything else you wanted to know? What's your concern on this one? So, doctor, I'm concerned, but maybe it might be affecting my kidney like my father. Means like say she mentioned two things over here. She mentioned
Mm-hmm.
about the kidneys and she's worried about the kidneys. Second thing, she was worried that it might be because of the family history. So she given you that clue that I am having polycystic kidney disease. Okay. On
So is
and
this
what
a
do
okay.
yeah, yeah.
Okay.
Yeah, complete doctor, please ask.
So is this is a breaking bad news, or I have to, adjust the, concerns like my father has this thing, and I will be having the issue, or like I was confused between this two.
No, here you can
So
say
how?
because this is a report because ultrasound already confirming that it is a patient having this polycystic kidney disease. So we have to say that this is a genetic condition, okay, where it is to develop in the kidneys over a time, okay. It can happen because of
Mhm.
each child having 50% chance, okay, as in your family,
Exactly.
okay, and progression is variable, okay. Some people have relatively mild disease based on patient condition again. So what are the aim? So, Mrs. Khan, I can understand your questions and query, but shall we have a different options and different plans to discuss on that one to minimize the effect. Is that okay? So for you, shall we discuss on that one? Then you can start. So first of all, our main aim will be patient's renal protection along with blood pressure. Okay, here we have
Mm-hmm.
to emphasize that strict blood pressure control. This is a key role in slowing down the progression of kidney damage. Are you getting me, Mrs. Khan? Okay,
Mm-hmm.
so for that one, Mrs. Khan, how about if like say we are starting some medication? So you are going to take up there you're going to take that permission. Okay, or just mentioning the patient. Okay, yes, doctor, what medicine you're going to start? Mrs. Khan, we have the option. We have a medication we call it ACE inhibitor or ARBs. As per indication, you can mention over there as per the guidelines. We will target our
Mhm.
blood pressure, and you have to mention about how much you wanted to keep the blood pressure. Okay, and since you say that, for example, if it is in the scenario patient is taking a lot of brufen medication or so many things are there, so I will suggest you not to take unnecessary medication, especially for the painkillers, as you're taking the brufen tablet because of your knee joint pain. I can understand it's really painful condition for you to work, but at this point, if like say you're taking this kind of medications without doctor's prescription and without doctor's advice, it will be harmful for your kidney. Are you getting me, Mrs. Khan? Okay,
Mhm.
yes, doctor. Okay, so then you have to encourage the patient about adequate hydration and healthy lifestyle. Okay, Mrs. Khan, as you mentioned that you're taking only 2 or 3 glasses of water, which is really insufficient for you and for your kidneys. Are you getting, Mrs. Khan? So you have to improve. Healthy lifestyle means you have to eat healthy. Specifically, you should not take any frozen item, junk food, and long shelf life food, and try to avoid red meat and reheated food. Are you getting me, Mrs. Khan? Yes. Now, Mrs. Khan, apart from that one, how about if, like, say, if I'm referring you to the kidney specialist to know about more about your kidney health, is that okay for you? Here, you should not say I'm going. You should not say that I'm going to refer you to the specialist. No. Okay. How about if I'm
Okay.
sending you to the specialist? So maybe the patient next statement was that the question was, doctor, are you sending me to the specialist or not? But you took over. Doctor, for what you are going to refer? Yes, Mr. Khan, that's a good question. We wanted to send you for some specialized care, and the specialist will be
Mhm.
nephrologist, and they will be taking care of your kidney filters. How about this? Is that okay for you? And they will be guiding you on the disease modifying options where available and applicable, and indications will be there, and more specialized care will be there. Are you getting me?
Mhm.
And yes, Mr. Khan, first of all, as you got this problem, so as you told that you have 2 kids and you're having brother and sister, both are everyone is doing good and well. Yes. So now family and genetic counseling.
Mhm.
Okay. Discuss the implication for the children and siblings. Okay. And offer referral for a genetic counseling to discuss the timing, pros and cons, and screenings and asymptomatic relatives. Okay, this is also the main agenda of this case to know about this thing. Okay, emphasize that we are here to support you all the times. If any questions, any queries are there, please come back to me. Testing and the children is complex. Okay, so that for that reason you should not say that we are going to test. So you say that I'm going to send you to
Mhm.
refer nerve specialist. They will be doing the screening or they will be checking your
Okay.
things. Okay.
Okay.
Or if like say she's going, the agenda might lie that she is a young patient, she's having this advanced kidneys problem. You have to say that I'm going to counsel you for the genetic counseling for upcoming children. Okay,
Mhm.
upcoming family. Then lifestyle and self-care. Okay, yes, mentioned. As I was looking at you, Mrs. Khan, that your BMI is 36. Is this really high? So how about you would think about exercise? So since you're running out of time, Dr. Simon, so you can say that I'm giving you this leaflet about your lifestyle and exercise, regular exercise. And if patient is smoking, you can give this leaflet again for the smoking cessation. So you have to come back to me if you have any questions and query. Is there any
Mhm.
questions, any queries you have at this point now? So please just tell me what to please let me know. So then patient will say, Doctor, no, thank you very much. Thank you, Mrs. Khan. See you next time. So if you have any question, query, this is my phone number. And
Mhm.
thanks. So this way you have to go for it. Okay. Now, doctor, there
Okay.
other
And
one. Yeah, doctor, please.
okay. If like this is not the, this is the genetic case, for example, yeah, of breaking bad news. But what if the patient is coming with any investigation? So like in any other case, so we will not do the investigations again. For example, the patient is coming with investigations, but we will not like repeat it. Yeah, I mean to say, in any case,
Yes,
like
I'm
this.
taking one example of this anemia case done by Dr. Alba. That case was a clear-cut cancerous pathway, 2 weeks referral. Okay, but
Mm-hmm.
for example, I'm just taking as an example, patient report is showing that patient gone through some routine testing, fasting blood sugar is high, Okay, but HbA1c and postprandial sugar is not there. Patient is asymptomatic. But for that one, I wanted to reconfirm further. Is it okay for you to do reports? So you have to do the reports. Where patient don't have any symptoms, but still some problems are there, and there is no strong family history, or there is no, relation with the patient's occupation or something. Okay, for example, with occupational, always we have to refer to the occupational specialty rather than dealing at our point. So
Mm-hmm.
again, then second thing, doctor, if for example, patient come with only X-ray report showing that is some sort of some mass is there or some what is there, still this is the breaking bad news. So you say that Mrs. Khan, I have seen the X-ray which shows that there is there is some sort of shadows are there. Not don't say the mass. There's some shadows are there
Mm.
which is not
Okay.
confirmed at this point. So to rule out further, we need to do few more investigation. Is that okay for you? Take the permission and then proceed. Okay, you should not say that I'm going to do a CT scan or MRI. No. Here you should say that
Mm-hmm.
to rule out further, we need to do few more investigation. Is that okay for you to proceed with that one? Then go.
Mm-hmm.
So we call it permissive way. Permissive way always will save you, no matter how bad the case you have done. But if you took the permission, it will be considered as a patient-centered. Patient-centered things always having higher marks than having higher knowledge. Higher knowledge, everyone
Okay.
having doctor, but how to be patient-centered and how to take the patient throughout the journey, that is art.
Okay.
Yes, doctor.
Dr. Imran, Dr.
Yes,
Imran,
doctor.
this patient, the similar patient for adult polycystic kidney disease, was she concerned about some scan of the brain? And she said that if I have, a doctor told me that I have to see chest doctor. What was that? I did not get it.
Okay, doctor, there are concerns are that maybe she read on the Google or ChatGPT that I have maybe this cyst gone into
Her,
my brain. So you have to reassure that one at this point. This is a polycystic kidney. It's not a cancer. It's a genetic condition. So it
her
will
father had
not.
the same.
Yeah,
Yeah.
your father had the same thing. Okay. So you should say that it is not a cancer, it is a genetic condition and it is related to your kidneys, not a brain. So you can say in this way, but again, for example, it say that renal cell carcinoma, and of course, patient might be worried about um, some sort of other organ involvement. But again, we should not say if like say we don't have an hard and fast or concrete proof with us.
Mm.
Okay, so doctor, I think brain aneurysm was about with the for the mother brain aneurysm was there. That was not a other condition.
So brain aneurysm is not associated with adult polycystic kidney disease.
I think doctor,
Doctor.
let me have a look because if I am not mistaken,
Because adult polycystic kidney disease, doctor, it's of two types. I think there is
yeah,
brain aneurysm also, and sometimes
yeah,
liver cyst also.
it is doctor, it is there. Okay, so but you should not say that I am
Mm.
going to do it. You are going to send to the specialist. Or you are not going to say that it is your brain also
So she
having the
was
same
concerned.
thing.
So she was concerned that if there is any scan for the brain, for example, what can I tell her? Yes, we can arrange CT scan to see
Yes,
the aneurysm, or what? How?
MRNGO.
Just
We will
MR
send you to
NGO,
the
but the thing
specialist.
for that one, no, for that one, MR NGO is not a GP domain. We have to send this
Yes.
patient to the specialist. For that one, I'm going to refer you. What they will do, their doctor, Mrs. Khan, they
Mm.
will do this MR NGO.
Okay, so we will send to the neurologist, huh?
Yes, doctor. It will be dual
Okay.
referral, doctor. Yeah.
Okay. Okay.
So that was the case. That was the scenario of that one. I have one case for Dr. Zulfkar.
Sir, what about
Yes,
the second
doctor.
case?
Yes, doctor. Dr. Zulfkar, after this one, I will just because I wanted to
Yeah,
notify you
sure,
earlier.
sure, please.
So, doctor, your second case was tuberculosis, am I right?
The first was tuberculosis. The second was, I think, PAD and along with peripheral neuropathy. I was mixed actually.
Okay, have you
And
examined this patient bilaterally
for the what?
for examination for the legs?
No, I just mentioned that I will check the dorsalis fetus and inspect the legs and this like this. I said like this.
You should say, I will do bilateral. Okay.
Yeah, I
Second
didn't
thing,
use the
doctor.
word bilateral
Yes, bilateral. But you have a good approach in a way that you are using the short sentences and most of the time, but you are using many time double barrel questions. Okay. Or, for example, as you say that you have any kind of high blood pressure and you having repetition of the sentences in that scenario. Otherwise,
Yes.
in that scenario there was nothing such thing to discuss.
So it was PAD.
Yeah, it was a PhD doctor.
But what about the like hair loss on the shin like this? Because it's usually happen in the diabetic neuropathy usually.
Doctor, yes, doctor. Now let me tell you again in a way. PhD, give me 1 minute because I have to touch that case again to get it more clear.
Because she
Okay,
was
doctor, this
diabetic as
patient
well.
was, yeah, 62 years old, diabetic, and she's taking ACE inhibitor and statin, and there is no antiplatelet, something is there, okay? But the thing here, for the management plan, doctor, we are going to explain the diagnosis, lifestyle management, and pharmacological, and referral. Referral for what? A patient having a significant functional limitation despite of exercise program. For example, first we are giving the program, exercise program, referring for the exercise program, but agenda comes again. Doctor, nothing is improved, so we are going to send the patient and suspected critical limb ischemia. Okay, like say,
Oh yes, I forget.
yes, doctor. Okay, for the
Taking the legs out from the bed.
yes, doctor. Patient having rest pain, like say pain on during the rest, and ulcers and gangrene, and supervised exercise program where we are wherever you see. But now this patient, mostly we are going to start from the scratch. We are not going to say each and everything, but we are going to start from lifestyle modification to the pharmacological. Okay, and
Mm.
after that referral, if like say if like say patient having red flags like the rest pain or ulcers or gangrene is there, we are going to send. But we examiner want to know about supervised exercise referral program. Okay, so what was the
Mm.
what it will be? So you have to explain the patient. Okay, so it is a structured walking near to the maximal pain. This is what examiner want to see. It is not something that we say that structured exercise program. No, how it will be and what it will be. This is what we have to tell the patient. Okay, and how long it will
Mm.
take to get impact. Okay, and how long
Mm.
we have to wait for it.
Dr.
Okay.
Imran?
Yeah.
Yeah, similarly, she was asking that if it is because of the poor circulation, this PAD.
Hmm.
So is it because of the poor circulation, or we can say there is some obstruction in your blood pipes? Is
Doctor,
it?
this is based on, yeah,
Mm,
we call it, we have to say that this is a peripheral artery disease causing intermittent claudication, okay? Because of your poor circulation, part of atherosclerotic changes are there. Means like say there is a clots or clogs, whatever the formation is there, okay? So you have to explain in your own words, like say patient center, patient word, okay? Rather than using that medical jargons.
okay.
Dr. Imran, can you please tell what is supervised exercise program you just told her?
Doctor, you can say that supervised or self-directed walking program to near to maximal pain. So it will be like say they will be guide you how to walk and how much you walk. Wherever you're getting the pain, maximum pain, you have to stop and rest and then repeat. Okay, you have to do this when it's several times per week. Okay, it's not a weekly one time or two times, several times per week you have to do to improve the collateral circulation. Okay, because it is means like said when you're Mrs. Khan, you see that you are getting the pain. But at this point, I will suggest you one thing that we will be. Going to send you. I'm going to send you for the structured exercise program where they will be teaching you how to walk and how much speed you have to walk and when you reach the maximal pain, okay, then you have to take the rest, and once it is subside again you have to start. Okay, so it will increase and it will improve your collateral circulation. So this is what they wanted to listen from you.
Mm.
Okay. Okay, doctor, so there is one case for Dr. Zulfkar.
Yes, doctor. Thank you.
Dr. Zulkar, yeah, your patient is 22 years old female, uh, Miss Suman. She come to discuss her problem with you, take proper history, and counsel her. Examination is not required.
Okay. Shall I start?
Okay, start.
Good morning, Ms. Suman. I'm Dr. Ali. How may I help you?
Hi, good morning, Dr. Ali. I just worried about doctor my skin. I want to take this injection.
Uh, Thank you for your uh, coming and consulting me. May I know why you want to take the injection for your skin? Any particular reason?
Doctor, I wanted to, my skin is dark, so I want to take this whitening injection.
Okay, whitening. Okay. Why do you think so?
Doctor, my profession need my skin brighter, okay, and my more prettier. I feel I'm dull.
Oh, I'm really sorry that you think like that, but I respect your concerns. So anything particular that that anything that going on in your mind, why you think so that you are not prettier,
Doctor, I'm model.
or you are a model and you want it to be fairer, a fair complexion you want?
Yes, doctor. I was not like this, doctor. It was
Mm-hmm.
nothing such thing, doctor. But recently, I
Mm-hmm.
have noticed that in my recent shooting program, I noticed that I'm bit dark. I'm getting a bit darker complexion as compared to my friend who took this injection. She's look more
Oh,
prettier and she's getting more offers than me.
mm-hmm. So, Ms. Suman, is there any previous picture you available to you right now?
Yes, doctor, you can see I'm look more brighter. My skin was fair.
Mm-hmm.
What happened to me, doctor? There's something wrong with my skin, so I need to change my skin texture. I
Okay,
want more better complexion.
I will get back to you after. But first of all, I need to ask you some more questions regarding this. Yeah, is that okay with you?
Sure, doctor.
Since how many months or days you notice that your skin become more darker?
Well, doctor, I was in an outdoor shoot in Thailand. It was on the beach side, doctor.
Okay.
And, it was quite good because it was a good opportunity for me and gone through. I came back almost now 6 months now.
Mm-hmm.
Doctor, I think my hormones changing, so I think I need injection. And can you give me this injection? Why are you asking me a lot of questions, doctor? Just simple injection. Just give me this glutathione injection, doctor.
Okay. Yeah, I will get back to your queries and worries also, but I need to make it sort it out. In which part of your body it is more darker?
Doctor, I feel my whole body is not into shape. Doctor, you can look, my shape is not like that one, like before in my picture. You can see in my picture.
Is there any picture available?
I showed you, doctor.
Just a second.
No,
Maybe.
it's not in the message. It's imaginary, doctor. Go ahead.
Okay. Okay. So, do you think that you are losing weight?
No, doctor.
Or how is your what is your weight now?
Doctor, my BMI is very good. 22, 23. Mostly I'm maintaining my shape.
Mm-hmm. Are you taking your foods regularly?
Yes, doctor, I am taking my regular food.
Mm. Is there anything that you wanted to lose your weight?
No, doctor.
And are you getting any vomiting after eating food?
No, doctor.
Okay. And any a recent weight change you noticed?
Doctor, nothing. I'm not noticed, Doctor Ali.
Okay. And any change in your appetite?
No, doctor.
Okay. Are you passing more urine than usual?
No, doctor.
Okay. And what about your bowel habit?
Fine, doctor.
What about your sleep?
Fine, doctor.
What about your mood?
Doctor, why are you asking about my mood, doctor? I need injection. Just give me injection. I can go. Just there are a lot of patients waiting outside.
Okay. So, could you please, may I see the injection, please?
Glutathione injection, doctor.
Glutathione injection. So, what is your idea about this injection?
Doctor, this is making skin whitener.
Okay. And okay. So, is there any other reason that apart from skin whitening, you want to get more prettier?
No, doctor, I just want skin whitening, doctor.
Okay. Have you ever taken this sort of injection?
No, doctor.
Okay. So actually, Ms. Soman, this is one sort of special injection, and this has to be given by the specialists actually. And because it's not because that, and it has some side effects which can be harmful to your skin.
Mhm.
So, are you aware of these side effects?
Doctor, what side effect, doctor? Side effect is nothing is there. It will make skin whiter.
Okay. Any other concerns you or your what is your thinking? What thinking you are going on right now?
Doctor, I just want this injection, doctor.
Okay. And any concerns you have?
No, doctor, this is my only concern, doctor.
Okay. So I will make an arrangement for, yeah, but I will definitely uh, talk to my skin department colleagues, to dermatology colleagues, to prior to giving you that injection. Okay.
Mhm.
Okay. So any other concerns you have?
No, doctor, this is my concern. Just give me injection, I'll go back.
Okay. Mm, Doctor, actually, I'm not getting anything
Go ahead,
to
doctor.
proceed.
Talk. Just wanted to, because this is something different we're bringing. Okay.
Okay. So, apart from this, yeah, you have any long-standing disease that you've suffered in the past?
No, doctor. No, doctor.
Anything in your family, like high blood pressure
No, doctor.
or any high blood sugar
No, doctor.
or any heart attack
No, doctor.
or stroke?
No, doctor.
Are you using any medication?
No, doctor.
Any allergies to any medication?
No, doctor.
Okay, so you are a model by your profession. I'm going to
Yes,
ask you some
doctor.
more questions. How is your period?
Doctor, my period's fine.
Are you using any birth control pill by any chance?
No, doctor.
And are you also are you married?
No, doctor.
Okay. By any chance you were smoking
No, doctor.
or drinking alcohol?
No, doctor.
Have you ever tried any illicit medication?
No, doctor.
Okay. Are you driving your car?
Yes, doctor.
Okay. And do you feel down and depressed?
No, doctor.
Any particular stresses?
No, doctor. I just wanted to brighten my skin.
Okay, I appreciate your worries and queries. Um, are you supported at your home?
Yes, doctor. I am living alone with my boyfriend.
Mm-hmm.
My sorry,
Okay.
my fiance,
Yes.
doctor.
Yes. Okay. Okay. Any other concerns you have?
No, doctor.
So, okay, I will make an arrangement for that injection to give you, but be aware of that the side effects there, and I
Okay.
will get back to you very soon
Okay, doctor.
with leaflets and brochure regarding your skin condition and regarding the injection